Painful periods are not normal, especially when women is between their 20 and 40 years of life. Let's talk about something that affects women silently, that is period pain, and why it should not be ignored. Let's clear a myth, and that myth is painful periods are normal. Painful periods, pain during periods to a certain extent is normal. But if you're dreading your cycle every month, curled up with hot bags, in bed, missing on daily life, work, that's your body is saying something is off. So why does even period pain happen? During period, uterus contracts to shade the inside lining of the uterus. And these contractions are triggered by chemical substances called prostaglandins. These prostaglandins in normal amounts cause mild cramps. But when these levels are too high, the pain becomes intense. So that's why we need to divide this as physiological pain or pathological pain. Physiological pain is something that mild cramps are there, mild discomfort is there, and it is handled by home remedies or little bit of rest, which doesn't disturb your routine life. But pathological pain is intense, it's severe. It starts before your period starts. It is there even after the period is over, and it disturbs your routine life. And it usually points out to some underlying medical condition. What is considered as upper limit of pain? The pain which makes you pop pills every month, which keeps you away from your work, colleagues or sleep. And most importantly, it worsens every cycle. Beyond the normal line, it's time to look deeper. What are the warning signs which tells that this period pain is beyond normal cramps? Pain that starts before your period and lasts longer. Pain during intercourse or bowel movements. Heavy or irregular bleeding associated with bloating, fatigue or nausea, and it causes difficulty in having a pregnancy. So a big question is, should we investigate? Should we investigate pain during period? So we begin with understanding your case, a detailed history about your menstruation, examination, pelvic ultrasound, and sometimes MRI is done, and even laparoscopy if needed should be done under the guidance of your doctor. Some of the most common culprits are endometriosis, when uterine lining grows outside the uterus, adenomyosis, when uterine lining grows in the walls of the uterus, pelvic inflammatory diseases secondary to pelvic infections, fibroids or ovarian cysts, cervical or uterine abnormalities, and all these require medical attention and not just a painkiller. And here is what something always overlooked is painful periods affect fertility. Conditions like endometriosis or pelvic inflammatory diseases causes damage to tubal function, poor quality of eggs or inflammation. These conditions reduce chance of your conceiving. So every woman out there, if your periods are hurting more than they should, then listen to your body. Thank you.